let's take it back to a true sports injury. We're looking at somebody on the Wesleyan football field or in Rocky Mount or Tarboro, and we take care of a lot of their injured athletes. And what would happen if they fall down on an outstretched arm and their shoulder dislocates? Versus the phrase separates, a shoulder separation versus a dislocation. Help us understand the difference between those two and what we would do about it.
Got it. So, two different joints. When we speak of shoulder dislocation, we are talking about the ball and the socket joint. So again, this joint here and the socket here. So because the joint is the cup is so shallow, the ball will, if enough force is applied, pop out of place. It most commonly pops out to the front, and when that happens, it sometimes requires a trip to the emergency room or a healthcare provider that's immediately on the scene to reduce it. The separation injury is between your collarbone and this bone right here. So the collarbone's not in this. Your collarbone would be sitting about like this. So that is between your acromioclavicular joint. So the clavicle is commonly termed the collarbone. So that is this joint, whereas the dislocation is this joint. So we hear about the separation injury a lot in football because when you kind of fall on the point of your shoulder, you will damage the ligaments in that joint, and that's a common injury in football. But that is not most of the time a injury that requires an operation. Many times we can treat that non-surgically with just rest and ice and time off. But when we have a dislocated shoulder, that is a little more serious and can many times require an operation to stabilize, repair the ligaments in the front of the shoulder to keep the shoulder from continuing to pop out of place.
So to summarize then, if the ball and socket joint separates, ball usually pops out of the front.
That's the dislocation.
Right. And we can often put that in without surgery. However,
correct.
When you pop the ball out of the socket and it stays in an outward position for a while, or just a trip outside of its normal location, that can tear ligaments that normally have the job to hold that tightly in place. If those ligaments are substantially torn, you may need a surgical reconstruction, particularly if you're a young athlete. Most older people actually get by pretty well without a surgical reconstruction there, unless they tear the rotator cuff from that trauma.
Correct.
And it doesn't heal. So if it doesn't heal, say they come to you very late in the game. So
to clarify that point, if you're under 20 and you dislocate your shoulder, your probability of that shoulder popping out again is pretty significant. If you're over 40 and you pop your shoulder out of place, you dislocate your shoulder, your probability that that shoulder is going to come back out of place is relatively small. And just as Dr. Perlmutter mentioned, the more common injury is you have injured your rotator cuff. As opposed to when you are a younger person, the more common injury is you damage the ligaments that stabilize your shoulder. So two different scenarios. We will try our best to manage these injuries without an operation, but if there is clear evidence that damage has occurred that will not heal itself, then you are best served with an operation. The good news is almost the vast majority of everything we do in the shoulder can now be done arthroscopically. And by that I mean using a camera through small incisions, do all the work on the inside. So outwardly minimal incisions. We do the operation on the inside. You come in, go home same day. And quicker recovery, less discomfort for you for the procedure. As an example, rotator cuff surgery is almost exclusively done in today's world arthroscopically. There are very rare occasions when we would consider a larger incision to repair the rotator cuff. There I'll mention briefly that there's a new procedure where if you've torn your rotator cuff and it's torn to the point where we cannot fix it, there is, in the last 6 years, become a great alternative that would allow us to put a graft, a soft tissue graft, in that area and take the place of that upper rotator cuff tendon, and it keeps the ball centered and helps preserve the joint so you don't develop arthritis. So that was not available before about 6 years ago, and what would happen is you would go on to develop severe arthritis and you would require some form of joint replacement surgery. So that is a real advance in the area of shoulder surgery to allow us to preserve shoulders so we don't have to necessarily replace them.
I'm going to just refresh the last comment that Dr. Martin said about using a graft, and use that as a segue to talk about the other major part of tonight's talk, and that's regenerative medicine, the use of stem cells to help augment tissue healing. And that means you heal faster and you heal more completely when we include stem cell products in healing. So he had mentioned that if the rotator cuff had a complete tear in it, and the olden days, 6 years ago, there's not much we can do to repair that other than really advance you towards an artificial shoulder, because we need tissue to plug holes. So if you had a big tear, and I ripped off a piece of paper here to show you what a graft would look like, and the rotator cuff was not repairable in this area here, we can take that graft and sew it into your natural tissues, and then use that graft to essentially plug the hole. And then over time, that graft, which is typically harvested from a donor, somebody who gave their heart and their lungs and their kidneys to help other people in distress in medicine, we take other tissues from them, process them, so the chances of a tissue reaction are way lower, and we'll sew this into your shoulder, or in this case, your Achilles tendon in your ankle, or your ligaments in your tendons in your knee, and we can use this tissue to augment our repair and increase your healing capability just tremendously. And so this is part of what we're talking about by biologics.